Immunization is not only one of the most effective public health tools, it is also a fundamental human right. Unfortunately, 1 in 5 African children remain unvaccinated. This week, our focus is on the importance of vaccination and how to catch up with the zero-dose children. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudpe. The conversation begins after this break. Please stay tuned. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is health specialist with UNICEF, Dr. Olufemi Adeyemi, and he is going to tell us how important is this public health tool, immunization. Good evening, Dr. Adeyemi, and thanks for joining us.
Good evening, everyone. Great pleasure being with you.
All right, 50 years after, it is still unfortunate that we're recording cases of vaccine preventable diseases. Tell us, how did we get here? And please share with us the true picture of things.
Thank you. Essentially, we are here with them because things have not been done the way they ought to have been done. When you're talking about why we are where we are today, we see how so many cases of incomplete vaccine coverage all over the place. There's so much of misinformation and hesitancy. And of course, when it comes to vaccination, what vaccination essentially does is to mimic the true picture of what usually happens when one is infected. So with vaccination and under vaccination, there are bound to be some level of mutation. The diseases you are trying to prevent, whether it is bacteria or virus, they become a bit slightly more resistant if the vaccination has not been done the way it's supposed to be done. And of course, now the world is global, it's a global village. There are no boundaries anymore. So there is so much of international travels here and there, so people can easily come and spread what is happening. And then we cannot rule out the issue of loss of conflicts, which you have all over the place, banditry, disasters, and the displacement of human settlements, which of course are very prevalent also in this country. And of course, lastly, we'll be talking about what of course challenges in vaccine storage and distribution. So a lot is being done now to ensure that this is updated.
All right, Dr. Adeyemi.
So in essence, what I've just said, if we really want this thing to go so that we do not keep on having vaccine preventable diseases, we need to have sustained education and improve all the access to vaccination. And there should be ongoing outreaches. And of course, we need to have the public trust, which is a very crucial thing at this time to overcome these challenges. Thank you.
All right. Vaccines are not just a lifesaver. They are also fundamental human rights. But unfortunately, we still have zero-dose children, record of zero-dose children. What do you think can be done if truly it is a lifesaver and a vital investment for every child out there?
Thank you very much. I think this is a very key question for me. Vaccines are not just lifesavers. They are actually a declaration of every child's right to the future. So for you to say a child has a bright future, that child ought to have been fully vaccinated. They are the hope. The vaccination is the symbol of hope, protection, and basic dignity every human being deserves today. And when you look at it, so for us in this part of the world, a lot of children are still left unvaccinated. This is not just a health issue, it is a justice issue. It is a human rights issue. And to change this story is very simple. We need to act with urgency and compassion. What to believe in. We need to reach all the unreachable, hard to reach areas. We have to reach all the displaced families in various camps. And to reach the urban poor. And then we must also equip our communities with the truth. When we're talking about equipping the community with the truth now, we're talking about letting them have the right information. Truth about vaccines and the safety, the effectiveness, and of course the God-given tool of preservation. These are all the things that we need to do. Also, we also need to empower our neighbors and engage faith leaders, inspire young people and partners, government, who will make vaccines access a national priority. The future of our children is not negotiable. The every short people is a statement that child matters, that this life is precious and that the nation has a future worth protecting. If you ask me what we need to do, I think now is the time for us to raise all our voices, because zero dose anywhere within the most time in this country is not an acceptable situation. Every child must be vaccinated. We need to open all our clinic doors. We need to cross every river and every mountain until no child, and I repeat, until no child is left behind. And vaccine equity becomes a shining testimony to all our shared values and humanity. Thank you.
All right, perhaps at this time we also need to remind our mothers, key players, family members, especially our husbands now, on the essential routine vaccines. I know there are routine immunization schedule for mothers, babies, pregnant women at the health centers. Maybe you need to remind them now on this platform, the essential ones they must get.
Thank you very much. Okay. There are so many vaccines that the child needs to have before the first birthday. At part, what is given at birth is called the light of BCG, which is supposed to prevent tuberculosis. This one should be given at birth or as soon as possible. Hepatitis B, to prevent this liver disease called hepatitis B infection. That one too is supposed to be given at birth, and then this one other later doses. For polio, other polio vaccine, which is usually called OPV, it is also given at birth, that will be followed with other multiple doses. The inactivated polio vaccine, which is the injectable form, that is normally given at 14 weeks of birth. And the DPT or DTP, that is diphtheria, tetanus, and pertussis, those ones are usually given at 6 weeks, 10 weeks, and 14 weeks. For influenza, which also causes some level of flu, this one is usually combined to prevent meningitis, pneumonia, infections, and is always combined with the DPT that I just talked about. There's also what is called pneumococcal conjugate vaccine to also prevent pneumonia, also combined again with that of DPT, also given as 6, 10, and 14 weeks. Some other ones are coming in that we're introducing. Some of we've actually introduced them. There's what's called rotavirus vaccine, which the country is just introducing. It's still beautiful if it was introduced sometime last year. This is to prevent severe diarrhea. caused by the virus. And this also given at 6 and 10 weeks, and sometimes even at 14 weeks. The measles vaccines, which I'm sure most members are very much aware of, is usually given at 9 months. Sometimes it's given with rubella, so don't usually give at 2 months or something. But that is also given between 9 and 12 months. Then, of course, the second booster will be required during the course of life. The likes of yellow fever vaccine, also give yellow fever vaccine at 9 months. I've talked about meningitis. It's also important for people to take them. Some occasionally they take for typhoid and some also take for fever. But aside just this vaccination, it's also a very important component that needs to be added, and that is vitamin A supplementation. Every child that is vaccinated without having vitamin A supplementation is still a little bit incomplete. So the supplementation for vitamin A is usually given at 6 months, and still give some booster or second doses as the need arises. This is also very important to help with the nutrition of the child and the growth of the brain and the development of the brain to its maximum capacity. Thank you.
All right. If we have the opportunity to meet a zero-dose child, what advice do you have for such a child or parents of that child? Is it reversible? Can the impact be reduced?
Yeah, thank you. Of course, the impact can be reduced because the child that is immunized, apart from being endangered, is also being endangered with those who are already immunized. So, but we try as much as possible because most, the way development takes place, the first 5 years of life is so critical. That will determine how far or how good that child is going to be. So, most cases, if a child has not had any form of vaccination at the age of 1 year, that child is referred to as zero dose. And we on our path will go all the way to ensure that such children are reached and are fully vaccinated and brought back into cycle. It's not only zero dose, because there's also another component of zero dose. Those who took some initial vaccination but didn't complete the whole course of the vaccination, those ones are also called the under-immunized children. Lately, I think in the UNICEF, we brought up this big catch-up campaign, and the big catch-up campaign is actually targeted at who has zero dose children and children who are under-immunized, all below the age of 5.
Your calls to action as we wrap up now.
My call to action is very simple. No child should be left. And in order for us to do that, we need to invest, we need to educate, we need to mobilize this very day to vaccinate every child and secure a healthier future. When we're talking about invest, that means we're talking about universal access to the vaccine. When we talk about educate, we're talking about families and also to counter all forms of misinformation. We need to mobilize the community, we need to get the buy-in of the community, and then we need to prioritize reaching the hard-to-reach children, whether they're in the rural or urban poor or conflict zone or displaced population. We need to get them. And most importantly, the one that rises in all this is for us to be able to sustain that political will and financial commitment, even when the disease changes to be later or to be low. If it's low today, does that mean I cannot prop up tomorrow? So we make that political will and financial commitment to ensure that we have children, that no child, is left behind. Thank you.
All right, no child must be left behind. Invest, mobilize, prioritize hard-to-reach children, and sustain the political will. That way, we will beat vaccine-preventable diseases. Dr. Olufemi Adeyemi, health specialist, UNICEF, thank you so much for your time on Sound Health.
Thank you very much. It's been a great pleasure being with you.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We have been discussing the importance of vaccination. Remember, vaccinated communities are healthy communities. No one deserves to be left behind. Vaccine protects and saves lives. They are also safe. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.
Looking for a program that would keep you informed, get you involved, and make your voice count? Then tune in to Citizens Gate, where we'll update you about government activities and the issues that may be affecting your community. On Citizens Gate, you also have the opportunity to communicate with government office holders and let them know how you feel and where the shoe pinches. With Citizens Gate, you are literally a stakeholder. Join us every Thursday at 2:30 p.m. on Lagos Television, and let's build a greater and smarter Lagos. Citizens Gate, a program that connects you to the government of Lagos State and its activities, is now on television. Brought to you by Lagos State Office of Political, Legislative and Civic Engagement. Citizens Gate, a must watch.
Your love is sweetness,
The female gender, as identified over time, is mostly at risk of sexual, domestic, and gender-based violence. Ironically, in recent times, the narrative is changing and the toll of domestic violence against men is on the increase. Titilola Vivo Adeyemi, the Executive Secretary of Lagos Domestic and Sexual Violence Agency, gives insight on a research conducted by the Lagos State government last year, which revealed that there were 340 reported cases of domestic violence perpetrated against men by their wives between September 2022 and July 2023.
We are encouraged by the fact that we are gradually breaking the culture of silence, even amongst the male folk, right? But ultimately, even if you check the data, 93% was from females, 7% was from males. So I don't think we can boast that we've broken the culture of silence for both genders, but it is encouraging that we have more men, having more faith in the system and reporting.
Irrespective of gender, domestic violence is still domestic violence, but people often assume that it should be the man who is abusing the woman. So most men do not speak out. So I think the awareness of women abusing their men